Hello, here is what you need to know about menopause. Menopause is a natural aging process in a woman during which she moves from the reproductive stage of her life to non-reproductive stage. Menopause is that time that marks the end of menstrual cycle in a woman. You are said to have entered menopausal stage when you have not menstruated for a period of 12 months consistently. In some women, it occurs in their 40s, in some in their 50s. But generally, menopause occurs in women between the age of 45 years and 55 years. But in exceptional cases, you see menopause occurring in some women before their 40s, some in early 30s. But there is one thing I want you to note today. Menopause is not a disease condition. It is not a disease condition. It is a natural biological process. The problem here is that the physical symptoms that are associated with menopause can be uncomfortable in women, and in some cases it can even be very severe. Menopause can result from natural decline of reproductive hormones such as estrogen and progesterone. It can also result from surgeries when we undergo surgeries that tampers with our ovary, or even a situation where ovary is removed, because ovary is the site of production of these hormones that can induce immediate menopause. It can also occur in some women that undergo chemotherapy or radiotherapy. That is, these cancer treatments can induce menopause, but it is reversible. It is not permanent. It can also, we have in some women that have what we call primary ovarian insufficiency. In those women, about 1%, a small percentage of women, that their ovaries are not producing normal level of these reproductive hormones. These women can go into menopause or experience their menopause before they are 40 or in early 30s. It can be genetic problem or as a result of some disease conditions like autoimmune diseases. But most women experience their menopause due to age. As they're aging, the reproductive hormone is decreasing and the function of these hormones also decreases. The problem here is the symptoms that are associated with this menopause. In the months and years leading up to menopause, what we call perimenopausal stage, you can experience some symptoms and signs. The key thing to note is that these symptoms and signs can last for years. In some women, it can last up to 10 years before they finally enter into menopause proper. And there are a variety of symptoms. It is good for you to know that you may not experience all these symptoms at a time. You may experience one or two. They can be mild, moderate, or severe. But the essence of this lecture is, when it is severe, more than what you can handle, please don't hesitate to do what? To see your doctor. One of the symptoms that occur in most women during this perimenopausal stage is irregular period. In some women, their cycle changes. It can be longer, it can be shorter, it can be severe, it can be lighter. In short, in some women, you see them, the period skipping. In some women, they can skip 1 month, they will not see their period this month. They are not pregnant. They will not see their period this month. Next month, it will come back. In some, it might be 2 months. In some, even 3 months. They won't see their period. After 3 months, it will come back. These are perimenopausal stage before menopause proper. But one thing to note here, that your period is skipping does not mean that you cannot get pregnant. You can get pregnant. So it is worthy for you to note that when you've not seen your period for 3-4 months and you are not sure, please visit your doctor so that you will confirm whether it is the perimenopausal stage of menopause or due to pregnancy. We have other symptoms like vaginal dryness. Due to reduction in this reproductive hormone, the elasticity of the vaginal walls is reduced. Therefore, in some women, they tend to experience pain during intercourse. If this is the case with you, please, you can see a doctor who will advise you on proper thing to do. We have hot flushes. Hot flushes, you have this, sudden wave of heat coming on you, and at times you don't even know what is wrong with you. One moment you have chills, the other moment you are hot. And so women, they're experiencing intense headache. It's just somebody said as if somebody is actually pumping something on her head. These things, there are a lot of changes that are taking place within your system this period, and they can instigate these things. That's why you need to do what? See your doctor within this period. You can have night sweats. You can't even sleep because of internal heat. You have sleeplessness, sleep problems, insomnia. You have mood swings. One moment you are sad, the other moment you are happy. You have weight gain, and within this period, that is, you have reduced metabolic rate. Therefore, you tend to gain weight even when you are eating so little. You have thinning of hairlines and dry skin, and then loss of fullness of breast. It's worthy to know that these symptoms, you may not have all of them at a time. This one can come for some months and go. After that, another one can come. But there are some women that don't even experience some of all these things. But the essence of this is that if you're experiencing it and it is more than what you can handle, please visit your doctor. Because during this period, women are prone to cardiovascular and heart diseases. You see some women developing high blood pressure within this period because of these changes. And women are also, apart from cardiovascular diseases, you're also prone to osteoporosis, because this condition causes bone to be brittle and weak, leading to increased risk of fracture. A small fall that you have in your home, you see you having fractures in your leg, wrist, and other parts of your body. And that is why you need to take care of yourself within this period. You can have what we call urinary incontinence. You lose the ability to control urine. Small thing, when you have the urge to urinate, before you could get to the bathroom, you have poured it on yourself. In some individual, even while they are talking, and somebody just a little bit of something that will make them to laugh, you see them, voiding urine on themselves. Some just to lift something up or cough, you see them messing themselves up. Some of these things can occur within this period just because of the changes that are taking place in our system. And then sexual function, like I said before, can also interfere with our sexual function because it induces dryness of the vagina, which can be painful during intercourse. And I said your doctor can assist you in this case where it is severe. Please don't hesitate to see your doctor. Why I'm saying this is, it's not good to recommend any medication online, because your doctor will look at you holistically, taking into consideration the medication that you are taking currently, and also be able to know what to prescribe for you do proper diagnosis and prescribe the right medication that will help you. Then within this period, there is need for us to have what we call lifestyle modification. Lifestyle modification. We need to take particular care of what we eat. We need to eat balanced diet, make sure that our food contains calcium and vitamin D, and also other vitamins that will also help us. We need to take in a lot of water. We need to take in a lot of water. We need to exercise. We need to exercise, avoid sedentary lifestyle, sitting down one place for long. Once in a while you get up and move around. We need to do things that will make us happy. Do things that will make us happy. Wear dress that will not expose us to heat. Because of the hot flashes we are having, we need to wear dress that will not worsen that situation. We also need to prioritize our health. Therefore, our doctor should be our friend at this time. Thank you very much for listening.